100?
Yeah, I'm going to 100.
Yes.
Yeah.
So good.
Okay, you're good.
All right, guys, this is Health Nibble number 85, and I'm interviewing Dr. Mindy Pelz. She's from California, Silicon Valley area. I've actually mentioned her before. I think I referenced her when we were talking about the safe dentistry. But anyway, Dr. Pelz is she has her own podcast called Women in Wellness, and it's an amazing podcast. Erin actually refers a lot of our female
Love it.
patients
Yeah.
to Women in Wellness. Yeah, it is. It's very good. She was one of our. So we had a protocol weekend on all the different things that we treat. You know, from brain health and neurotoxicity and Lyme disease, and Mindy is one of our guest speakers. So she's an absolute expert. She's been doing functional medicine for a while, and one of her protocols was on teenage anxiety and depression. In our clinic, we just see a lot of kids that are put on antidepressants, and parents don't know what to do, and they think their kids are just screwed up and they're bipolar, and they're not. You know, I always say we have healthy genes, and we're just toxic, and we have to figure out what's wrong that's not allowing our God-given genetics to express health, and that's what our expertise is. So I guess, with that said, could you maybe give some of those examples that you were talking about that you've had with high school kids? And
what I think is really damaging to the parent right now is, and I'm a parent of 2 teens, and I know you got kids, is that we tend to blame the anxiety, the suicide, the stress problem on what's going on with the pressures at school, with social media, and these are not circumstances you can necessarily control. But what you can control are things like toxins in food, and we talked a little bit about like exposures, like mold in people's homes.
Yeah.
So I call it a brain on fire. That the teenage brain is literally so inflamed right now that even the smallest little bit of stress is causing kids to just overreact. And so there are some things you can do, like we know there's a gut-brain connection.
for sure, we've had lots of health nibbles on that gut-brain connection. It's such a big part of it.
Right. So restore. Restore is great. Fix the leaky gut. Get them off of wheat. Start buying organic. Those are simple things you can do now that can have a really long-term effect. Other things like minerals. So we see a lot of concussions. You guys see a lot of concussions in here. So personality changes after a concussion. That's a brain on fire that got nailed by another brain, and now it's even more inflamed, and it is crying out for magnesium, zinc.
Yeah.
It needs mega doses of minerals. So going and reaching for supplements at that moment can have such a huge impact on brain health and how your kid will respond.
And you gave an example of one of the cases where you had, a teenager that had suicidal sort of thoughts and tendencies, and it was a mineral deficiency issue, right?
Yep, we've seen this a lot with suicidal thoughts, and that come out of nowhere, and the parent goes to blame the circumstance, and it's really this brain is crying for more minerals.
Yeah, or so much anxiety, can't cope at school, that sort of stuff. So, so some really neat stuff. So what are some of the tests? When you talk about the gut-brain health, what are some of the tests that you do?
We use Gut Zoomer. We love Gut Zoomer because so many times I've tested, or I think somebody's got Candida and we test it and they don't, or I don't think somebody's got Candida and they do. And Gut Zoomer is really easy to do on kids. It's just a stool sample, we send it off, and boom, we come back and it'll tell us 2 things. Do you have any of the bad guys, and do you have enough of the good guys?
Yeah.
So there's 2 things to be addressed, because a lot of times just the fact that you don't have the bad guys, you still need to feed the good guys and figure out how to bring in some polyphenol foods like hemp seeds and chia seeds and olives, foods that feed these guys. You need to intentionally feed them. But a Gut Zoomer will tell us what's going on, so you're in the ballpark to know how to approach your gut.
So that's the Gut Zoomer. It's the same one that we use, but that's when we talk about knocking back Candida, and then we talk about heavy metals. So the Candida hide in the biofilm around heavy metals, and so that's a huge part. We train on the same stuff, but that's a huge part of that complete protocol, the multi-therapeutic approach. And then you mentioned another thing. So we just came off of a 5-day water fast. I think I did 12 health nibbles on fasting. And so you gave an example of, a patient struggling with psychosis, and just putting them on the fasting was just a game changer as far as that mental healing.
Fasting is the quickest way to bring down inflammation, like bottom line. So if you can get somebody on a 4 or 5 day fast, you might not get a teenager on that, but if you can get an adult on that, the brain comes down, the nervous system calms, and all of a sudden somebody with anxiety can really start to see above that. Now, what do you do with teenagers? So I just start to push breakfast back. With my 16-year-old, he walks out the door, and if he doesn't eat breakfast, I don't follow him with a bagel. I just kind of check in at the end of the day and go, how did that work for you? Did you get food at the mid-break? How did you feel? And we kind of talk that through. I think a lot of parents are shoving food in their kids early on, cereals and orange juice. They're giving them all these high
the sugars.
And thinking they're doing something good, but they don't realize we got brain inflamed. We just inflamed it more.
Grain and sugar inflames the body, inflames the brain.
Yeah.
It's already inflamed. It's already toxic, and so you just make it worse. Scrambles the brain even more.
Yeah.
So we talked all week about ketones, and when you can move into that state of ketosis, you really get some clarity. You get brain healing, all of that. And, you mentioned that stuff today. So I just thought it was, really neat. Sometimes when parents, they think all they can do is give them drugs, and it's just not root cause. Giving drugs is just not root cause. So.
And the long term, if you don't deal with that brain on fire, you don't deal with what's causing the anxiety, the drug is a temporary solution that's going to come back and create an adult health problem.
Oh, for sure.
So,
we see that all the time.
Right?
It makes it even harder to fix. So.
So.
All right. Well, that's your health nibble for the day.
Mindy.
Teenage anxiety. Thank you.